And our last poster presentation is by Melissa Biscardi, who is a concussion clinician, educator, and PhD graduate specializing in oculomotor rehabilitation and sex-based differences in concussion outcomes. Her work focuses on technology-driven assessment and rehabilitation to improve concussion care in community settings.
So today I'm going to present part of my doctoral work, which was on oculomotor rehabilitation after concussion in adults, and I'll be focusing on tolerance to virtual reality, which is how we delivered the technology. Visual impacts of concussion are common, and they can persist months, years if left untreated. There's growing evidence in support of oculomotor rehabilitation, which is being shown to improve symptoms and visual function. Virtual reality offers a novel and engaging way to deliver oculomotor rehabilitation. However, it's unclear if this is tolerated in symptomatic concussion patients, I guess, and if there are sex differences. So we wanted to fill this gap. We recruited adults from the community aged 18 to 42 who were within 1 month and 1 year post-injury and were experiencing visual symptoms. We delivered 6 weeks of OMR, oculomotor rehabilitation, with home-based reinforcement, as you can see on the screen. And we measured tolerance to the technology with the simulator sickness questionnaire. The intervention was 6 weeks, and it was progressively more difficult. So our results, we had 24 participants, 14 were female. The participants were very reflective of the community, age 28, and time since injury around 25 weeks. The intervention was very well tolerated. You can see in the graphs that the most symptoms were experienced on the first week, and then there was a huge decrease or habituation between week 1 and week 2, and it kept decreasing over time. There were sex differences in terms of the trajectory, but the difference was not significant. And so we found that repeated VR exposure in adults who are symptomatic demonstrate strong tolerability. And while males and females show different trajectories, these findings are not significant, at least in this sample. And for future directions, we want to determine optimal timing, progression, and also content. And it's important to look at the hardware that is used and if there's any influence of factors such as interpupillary distance calibration. Thank you.